Welcome. I'm Dr. Steve Grinstead, and today I want to talk about a topic I haven't mentioned for a while in my blogs, and that's about depression. Over the past 30 years that I've been working with people with chronic pain and coexisting problems, or people with addiction, mental health problems, I've noticed that the holiday season are a time when a lot of people are at higher risk for experiencing depression symptoms. Now, some people experience what's called a seasonal affective disorder, and for others it's just the stress of the holidays and bringing back painful memories from the past. I know for me, I tend to go in cycles. There's times when I'm feeling really upbeat and positive and everything, and there's other times, like most people, where I feel a little down and low. There's a big difference between this feeling down and blue and feeling clinically depressed. One of the things I want to share today is a quick 5-point checklist, and if you have 2 or more of these symptoms, you might want to talk to somebody and see if you might benefit from getting some help for depression. One thing that I've noticed, number one, is when people are struggling with wanting to even get up in the morning and having trouble experiencing pleasure or any interest in their life. And, I would encourage you, rate these on a 1 to 10 scale. If you're over 5, that means it's something worth looking at. Now, the second piece is, have you noticed you feel really sad and maybe crying for no apparent reason? Or on the other side, do you tend to be more irritable or angry and have outbursts without real legitimate provocation? And again, rate this the same way. And if it's 5 or over, it's an indication maybe it'd be a good idea to talk to somebody. A lot of people who start experiencing a depression disorder, one of the symptoms is a change in appetite, or weight gain or weight loss. For some people, they lose their appetite completely. For others, they get voracious. They want to eat, or they're starting to use food to cope instead of for fuel, to feel better, comfort food. The next one is feelings of hopelessness or worthlessness. Getting down on yourself, putting yourself down, feeling like life's never going to get any better. And the final one, and this is a real key, crucial one, experiencing suicidal thoughts, feelings, or behaviors. Now, what I mean by that is, it's normal. A lot of people think, oh, I'd be better off dead, or something like that. Oh, life isn't worth living. That's not what I'm talking about here. What I'm talking about here is, do you have a thought that says, I really want to die, and let me see how I can figure out how to do that? That's a big red flag. That means please get some help. Now, a lot of times depression, especially if it's minor to moderate, doesn't need medication. When I'm working with somebody, the first thing I want to start with is helping them change their thinking and behaviors. We call this cognitive behavioral therapy. However, if it's severe depression, they may need to be assessed by their doctor to see if an antidepressant might be appropriate. There's some simple things to do and not do when you're depressed or feeling down. The first thing is, do not isolate. We're in bad company when we isolate and we're feeling down or depressed. Another is, change your level of activity, increase your level. Get out and do something simple. It can be as simple as walking. Walk around the block. It can be honestly that simple. The other things people can do is to start identifying negative, irrational, or self-defeating thinking patterns and start coming up with some positive affirmations or positive challenges. One of the tools I often suggest is to make a list of everything you're grateful for when you start feeling down. There's a lot of things people can do when they're feeling down and depressed. And if you think you might need some help, please reach out to a mental health professional and see about getting some support. Because depression can lead to serious health problems. And when you're living with chronic pain, depression is one of the most common co-occurring conditions that people experience. And the good news is, if you help your depression, you'll help everything else. Your quality of life will go up. And I believe that depression leads to suffering. And I also believe that freedom from suffering is possible and preferable. And it's everyone's right. And I also believe it's a responsibility. So please, if you know somebody who's depressed, or if you yourself are feeling down, low, and depressed, please read the remainder of my post. If you're watching this on YouTube, go to my personal blog and look at my tip sheet for things to do and things to avoid when you're depressed. Thank you very much for your attention, and I hope you're having a wonderful holiday season and that 2014 will be a phenomenal year for you. Thank you very much.